Today we're going to be talking about persistent concussion syndrome. So this is usually considered 4 weeks or more after injury, dealing with about 3 at least of the following symptoms: headaches, dizziness, fatigue, irritability, sleep problems, concentration, memory, problems tolerating stress or emotions or alcohol. Usually for adults, these symptoms last around 2 weeks or longer. For kids, they can last anywhere between a month or more. So usually about 30% of all concussions will have some type of long-standing symptoms of 4 weeks or more if there is no interventions to help treat these specific symptoms. All right, so we're going to talk about some of these today and what we can do about it. Some of the main theories that come from this are blood flow issues, metabolic, inflammatory, or hormonal problems, vision and or vestibular dysfunction, cervical spine or neck issues, and then psychological components. Okay, so we're going to dive into that, starting with blood flow abnormalities. So usually persistent symptoms don't reflect any one pathological symptom, but usually a constellation of non-specific symptoms that could be linked, or but they don't reflect any specific physiological injury to the brain. It can just be a compilation of many things that you're just feeling overall negatively with. Some of these difficult cases, they should be managed with a multidisciplinary team or healthcare providers with specific experience with, say, neuro or vestibular experience. So choosing an appropriate rehab specialist is important in order to do that, or having someone that is able to refer out to the necessary specialists if it's outside their scope of practice. So altered cerebral blood flow, usually found after an injury where there's a disruption of blood flow to the brain. They can usually cause an increased cardiovascular output during exercise, which can set off your symptoms too. So a poor tolerance to exercise is usually something felt. And then you could also get blood flow abnormalities that could be contributing to these long-term prolonged symptoms. Another issue, you could get dysautonomia, which is the inability for the brain to stay or the body to stay at a steady state. So you could get orthostatic hypotension or tachycardia, which is orthostatic hypotension, a drop in blood pressure when you go from sitting to standing, causing some dizziness and issues, or you could get orthostatic tachycardia, POTS, which is an increase in heart rate with position changes. So that can cause levels of stress and anxiety too. So the treatment for this, though, is subsymptom threshold exercise, meaning a closely monitored active rehab program that involves a controlled subsymptom threshold submax exercise. So basically exercising under the level of intensity where it's not going to set off your symptoms. Okay, so here at Elevate, we do specific tests in order to find where that threshold is, and we would develop a program for you that would be appropriate to stay under that to not trigger those symptoms and create increased sensitivity with exercise. Number 2, the metabolic, inflammatory, or hormonal component. So for metabolic, oftentimes, we talked about this in the last discussion with concussions, that possibly there's some lingering ATP deficits, so the brain's not able to create energy stores in order to function properly, no fuel for the machine. There could be an inflammatory component. So inflammation starts through traumatic event, and the body processes that, but that can create more inflammation in and of itself, creating a cyclical cycle. So microstructural cell death can cause an inflammatory response, and then this continuous inflammatory proliferation can cause further cell death, more inflammation, and the cycle continues on and on and on. And you need something to break that cycle. This could be cause just general ongoing brain inflammation, may be then the issue that we're dealing with. There could be a hormonal component. There could be a pituitary dysfunction. So the pituitary gland is deep inside the brain. That can get direct trauma damage, so either compression of the glands or either a shear injury or the blood vessels that give blood flow to the pituitary gland, that could also be compromised. causing any kind of persistent neuroinflammation or accumulation of proteins inside. That can wreak havoc inside. There can also be something called intestinal hyperpermeability or leaky gut syndrome. So basically, the space between the cells of the colon lining, of the lining of the intestines, they tend to space out after a traumatic event. Usually, these cells are preventing certain components from being absorbed from our intestines, from the food that we eat, into our bodies. Those extra spaces are allowing a lot larger protein molecules to get in the blood flow, things that normally should be kept out. The body's ready to react to some of these things when it's regulated correctly, but when there's a massive influx of all these, it creates a huge inflammatory response. So this leakage of the intestinal content into the bloodstream can cause an immune system response, again creating inflammation. Then the liver gets overloaded in its ability to filter out all of these pathogens. So then you get leaky gut, which then can cause leaky brain, which includes symptoms such as depression, anxiety, brain fog. That's a big one. So not good. Hormonally, the thyroid can be issues, and this is a very common issue post-concussion, is having thyroid. So hyperthyroidism, or an increase in thyroid production, that can increase insomnia, anxiety, all kinds of neurotic issues there. Hypothyroidism, or the thyroid functioning poorly, this can cause fatigue, depression. Long term, it can cause neuropathy and poor memory based on just the imbalance of hormones inside the body. So a summary of the metabolic issues: there could be an ion imbalance, all right, that's not allowing ATP to generate an energy deficit. You could have neuroinflammation starting acutely that could develop into a chronic state. You could get dysautonomia, your inability for your body to maintain everything at a steady state. Disruption in blood flow, leaky blood-brain barrier due to the leaky gut, and then endocrine imbalances, so a disruption of hormone release. Number 3, our vision and vestibular dysfunction. Vision is very integrated with everything we do: walking, reading, playing sports, etc. And it's a pretty common dysfunction that can occur post-concussions. So oftentimes this can be a dysfunction of the sensory input that's coming to and from the brain and the inner ears, all right? So there's a poor link between that. And this can be very influenced by anxiety. It can sensitize things even further, cause greater disruption of the signaling between the brain and the vision system. Usually with eyes, post-traumatic vision syndrome, common symptoms can be dizziness, balance issues, car sickness, light sensitivity, blurry or double vision, headaches, depth perception, inability to read both written word or at the screen. You could have a reduced sense of where your body is in space. Difficulty recalling visual information. You're not able to fully process and focus on something, so therefore you're not able to retain it fully. For the vestibular system, vestibular again is inside our inner ears. The main component are the semicircular canals. They act as a motion sensor that converts our head movement in space to nerve signals to the brain to determine where our head position is in space. If this is not working correctly, you can get dizziness, you can get sensations of feeling off balance, you can get all kinds of motion sensitivities, things like that. You can get something called nystagmus, which is involuntary bouncing of the eyeballs when you're moving them, when you're tracking. And this is a combination of both peripheral, outside, and central inner dysregulation. You could also get vertigo, which is the feeling of your overall environment spinning in space. That can be a really tough one to deal with. We see that commonly when it's vestibular issues. And remember, the neck can also provide a huge amount of feedback both to and from the brain. So again, the neck is very closely linked to the inner ear canals, our vestibular system, as well as our vision system, okay? Vision rehab, you're thinking of it this way, usually it's involving training the brain to be able to use our eyes with less effort and more effectively, all right? Oftentimes there's just increased demand, and so it can get overwhelmed, and then you have all kinds of issues with that. But the main goal for vision therapy is not to strengthen the eye muscles, just to make them more effective, okay? So they don't have to take over the lack of input or disinput that's going on from vestibular and or our proprioception in our neck and our head and so forth. Usually these symptoms are also going to include a combination of use of optic devices such as prism glasses, and then a combination between vision and oculomotor therapy, okay? So very closely linked, the vision and the vestibular systems. Specific to the vestibular system, our inner ears, this can be provoked by rapid head motions, so turn your head quickly. Blurred vision may be reported with specific head movements. So again, there's just a miscommunication between the two systems, which can cause the brain to have trouble deciphering what's going on. So usually people that have persistent dizziness and gait and balance dysfunction, they seem to have some improvement when it comes to with a round of vestibular rehab. Number 4, again, I mentioned it briefly, but let's dive a little bit deeper into the neck. Again, there are a ton of sensors in our neck to determine where our head is in space, and again, to help our vision system, our vestibular system, determine how our balance is going. All right, that's really what it is. It's all to help with the balance. So it's pretty overlooked and a very underappreciated area when it comes to post-concussion. Something to consider, and I mentioned this last time, for every concussion, there's an element of a whiplash. So for a concussion, you have to have about 70 to 120 Gs in order to suffer a concussion, but for a whiplash injury, you only need about 4.5. So if you get a concussion, more often than not, you're going to be dealing with whiplash symptoms as well. Remember, our vestibular system has to have all 3 systems working together. They all have to give you the same information, all right? So that's our eyes, inner ears, and that's our neck, okay? Without this consistency, you're gonna feel very off, okay? Headaches can also be a very common symptom post-concussion. So, and we found that manual therapy interventions, both in the cervical and the thoracic, the upper to mid-back regions, can greatly reduce headaches and dizziness in patients after about 2 weeks of treatment. So again, Elevate has physiotherapists, we have chiropractors here, more than happy to do our manual hands-on. We're very highly competent in that sense. Number 5, psychological factors. We found that pre-existing psychological disturbances can greatly increase the risk of developing persistent concussion symptoms, specifically if you're dealing with mood disturbances, if you're dealing with anxiety issues, if you're dealing with depression, okay? One thing that can save this, though, is having a psychological resilience. And this is a little theoretical, but basically they're stating that interpersonal qualities that someone has can enable them to successfully adapt to adverse events, such as an illness or an injury. So you're going to have a tolerance to negative events. You're going to have a positive acceptance of change. You're going to have perceived control of the situation, and you're going to have personal competence, your thought on your ability to handle the situation. Things that can influence this are perceived recovery duration, the degree to which the symptoms are experiencing and contributing to your condition, your perceived control of your overall illness, and your degree of understanding of the illness. So if you feel that you have a good understanding, you're going to have a better prognosis. If you have a high anxiety state, this has been shown to be very important to have a poor prognosis. So your mindset is everything.